Hello, Alex.
Hi, it's a pleasure to be here.
Today we will be talking about digital communication in medicine. Our life daily is more and more impacted on our digital world. Whether we are aware of it or not, we always check on Google first and then we take decisions. Almost for everything, before shopping, before buying a house.
Absolutely.
And
And
so
in healthcare and in medicine, communication is an often undervalued or neglected element, but it is probably the most critical part of a good healthcare intervention, because without a good communication, there cannot be a healing process. I remember an author once said that communication and the physician themselves are like a drug if they should be given in the appropriate dose. So communication is extremely important. And now that we have the digital capabilities enhancing regular communication, digital communication itself becomes a really important element for both professionals to be trained in, which means physicians and healthcare and other healthcare professionals to be trained in digital communication, but also the patients and ultimately all of us, because at one point in life, each of us is a patient.
so that's why you are talking about Dr. Google.
Absolutely, because many people are looking to Google to find answers before they actually go to a physician. Whenever somebody has a symptom of some sort, they look on Google to see, has somebody had such a symptom or such a condition, and what can be done with it. If it's a simple condition and they find the answer, they might not even go to a physician. Now, the issue with that is that people need to be aware of the way our mind works, so the cognitive functionality of our mind. We tend to have a different viewpoint depending on whether we are communicating information from us to the outside or receiving information from the outside in. The sequence between having positive and negative news is different between outbound communication, where we prefer to say the good news first, and inbound communication, when we prefer to receive the bad news first. This has very significant implication when we're searching on Google, because when we see the listed results, we usually tend to click on those results that are more negative, because we want to be forewarned just in case we miss something significant. But actually, this gives more clicks on negative informational links than on positive ones, and ranks them higher in the listing of the Google algorithm, which basically means that whenever we search on Google for something simple, like, I have a rash on my left hand, ultimately we reach a point where we say, oh my God, I have cancer. So that's why Google cannot be used as a proxy for going to a specialist to see what the problem is, because trained physicians know how to prioritize based on the overall condition of the patient. And it's not just the negative things they see both the negatives and the positives.
Oh, I see. So what I'm doing, I'm proposing that professionals take advantage of Google tools like Hangout and talk, make
Absolutely.
broadcasts, video, write articles and posts, so that they can contribute with their professional trust and authority to
Absolutely.
relevant results.
Absolutely. That is a very critical and very relevant suggestion. The only concern is that practicing physicians in this age and day and age are so busy with administrative tasks, clinical activities, teaching, scientific activities, that it's very often not only digital, general communication tends to go lower on the priority scale, which is a shame, because ultimately what the patients most miss in the transaction between a physician and a patient is not the informational exchange. Of course, it's important, but information they can get on the web. What they miss is the actual communication, the peer-to-peer or the person-to-person, face-to-face communication. So absolutely, physicians should extend that possibility of face-to-face communication with the digital channels to enable to see a wider audience and to show the relevant and the competent information behind the subject, not only the things that patients are searching for.
So you see that there is a bridge between the user, the patient, and the doctor on digital communication.
Absolutely. I read last week, I read a post which actually, to that same effect, talked about the fact that patients who are searching, especially patients with chronic long-standing diseases who have been with the disease for a number of years, are looking for all kinds of stakeholders to connect on the net, to be able to share ideas, ultimately to improve each other's knowledge around the subject, which means all stakeholders related to the treatment of a disease, not only the physician and the patient, but also nurses, pharmacists, pharmaceutical companies, healthcare alliances, the regulator, which is the National Drug Agency. All of them need to have this conversation online, to be searchable, to be readily accessible, so that we have a balanced view of all the viewpoints on the net. This is something like net neutrality, where each of the elements of the system must have an equal balance in the possibility to reach those who are searching for information.
That sounds really great opportunity.
It's
something
a great
like
but,
revolution.
Yeah, but in order for it to become a reality, people need to understand that there is great benefit in digital communication, and it's not just add-on or making it cheaper. It's an extension or a turbocharging of the normal communication. So actually, it shouldn't be viewed as a proxy for normal communication. So it's not a substitute of a normal communication. It's a different type of communication which has its positives and negatives. As we say in medicine, it is the dose that makes the drug. And in this case, it's not only the dose, it's the type of communication that must be used appropriately. So digital communication has its indications, its counterindications, and its approved dosage. We shouldn't be under or over that dose.
I see. So it's specific. Do you think it's more focused because you connect only on certain topic?
Well, when people are searching, they're searching for a topic. Not always the patient is enough informed to be able to search appropriately. So they kind of tend to have broader searches at the beginning and narrow them down as they go deeper into the issue or the problem. But I think the real big benefit of digital communication is the ease of use. So patients who are not very mobile, who are homebound, or who have difficulties in going a long distance, for example, to get a consultation with the most relevant physician in the other end of the country, or maybe even in another country, these boundaries are demolished when we're using the digital communication channels. So we can reach any physician who is ready to help on the other end. That means that we have a global market where the demand can meet the needs, and ultimately this can lead to much better care for patients, a much higher profile of competency for physicians, and the use of digital communication there where it can achieve the most benefit, the highest value.
Yeah. So this is the way you see the future of digital communication.
Absolutely, and it's not only myself. I understand that China has a very large project underway to digitize healthcare, because you can imagine with the amount of people they have, I think by the year 2020, so not very far off, in about 5 years, they will have almost 900 million septuagenarians, so people 70 years old or older, which means quite aged people. And these are distributed widely across the whole country. It would give an enormous burden for the healthcare system unless there are digital ways to optimize the delivery of care, to understand where the patients who need face-to-face care really are. I know it's not the same. It's not as going to the physician and getting personalized care, but ultimately it's the next best thing. And when we are resource limited, we need to be thinking of how we are distributing our resources too in the healthcare system.
Yeah, I've seen, for example, when elderly people start communicating on Skype, on Google Hangouts, they just get it immediately.
Absolutely, yeah.
Yeah, they are more like connecting in like in real life. Then most of for example, my classmates, they just don't know how to communicate. They treat it like something not serious or even not existing. They deny it.
One of the really important things to understand is the landscape of the digital communication space. Now, most of the millennials, the youngest population, the youngest part of the population who are active on the net, have forgotten email and have forgotten Skype to a large extent because they use instant messaging of one of the different platforms. Even Facebook is starting to decline in popularity amongst the youngest population. But Skype and other video conferencing solutions, including Google Hangouts, are very much prevalent in the population who, for some reason, cannot go out and cannot socialize in the same easy way. So actually, elderly people very frequently communicate with their children over the ocean or over in another country through Skype in a very large proportion. Even in our country, in Bulgaria, there was on TV about 2 months ago, a shepherd, a guy who cares for sheep, who was bringing his IT along and communicating with his children through a mobile link up. Now, that would normally not be, it would be unheard of, but the fact is that people use it because of the value that type of communication enables, not because of the technology. Technology is never the first thing. It's the value related to the lifestyle of the specific population.
I absolutely agree. I absolutely agree for the value. It's very important to understand that it is a new tool to bring value. It's not anything that is magic or like existing for itself. Yeah.
Absolutely, yes.
Okay. So the last question is, why is it so difficult to switch the point of view? When people value what they get, you just told a brilliant example that they find a way to communicate and learn. And when we have to contribute to understand that these people need a relevant result, we just don't put any effort to help other people, even a little bit.
Actually, probably the answer is contained in the question. And ultimately, it's that any new thing requires effort. And effort is something that we feel we should not invest unless we see the return. It's not that obvious with digital communication what the return is. And because there's relatively little scientific evidence yet, I'm positive there will be more scientific evidence, but currently there isn't that much evidence around. So people who are not digitally savvy, they think of the technology as, oh, it's too complex. I don't want to put the effort to learn something new. I make do with what I have. Currently, I'm having what I need. But if you're low on resources, if you're very geographically far away from your source of communication and you need to make that communication, as is the case when your kids are in another country, you cannot travel every month, so you're restrained on resources, that forces you to think about this. And actually, when you go online to see, wow, that was easy, why not? So you need a little bit of nudge to kind of push you in the right direction. And that's what I believe we need in medicine too, because currently more patients are on digital communication channels than physicians are. physicians are relatively more in the back burner, so a little bit less concerned or less engaged with the digital ways of communication, because they're doing their day job and they don't see the need, the critical need yet. It will be evident in a couple of years, or maybe even sooner, but it hasn't yet become very obvious, and that's why in most of the schools in Europe, digital medicine is not a subject on the curriculum, sadly. Even in Bulgaria, there's only one university that actually put it on the curriculum as an elective subject. And I had the privilege of actually talking about that, because digital communication is definitely the future of healthcare provision, but it has a defined place and it needs to be put in the overall framework of healthcare in general, where it can do a lot of things. It can improve communication, it can make some things cheaper, it can enable access to other things which currently are not available so easily. So it needs to have its defined place, and we need to work together to make this happen.
Yeah, I remember you talked about the period after the healing in hospital, when people need attention, just empathy, to feel better and recover quickly, because when they go home, it's just a human feeling that they are left alone, and this will help enormously the quick recovery.
Absolutely, and often it's not necessary to go back to the hospital so frequently. Sometimes it is necessary to check on surgery or things like that, but it's not always necessary, and physicians are in a position to decide, is it necessary to do a face-to-face checkup, or can we do this over Skype? And if we can do it over Skype or Google Hangouts or another video solution, it would be great, because then both sides would use only the time necessary for the communication and not the time leading to the communication and the time after the communication, which will be downtime or lost time for both parties. Yeah.
Okay, thank you. It seems that there are multiple effects of digital communication, and hopefully more people get it and improve their skills to have a better life on everything, better results, better health, better business.
Absolutely, absolutely.
So we will continue our next conversation too.
It was a pleasure. Bye-bye.